Hi, my name is Mahmoud Nassar. I'm a consultant ophthalmologist. Today I'm going to talk about the adult cataract surgery. One of my subspecialties is cataract surgery, and I perform surgery starting from the age of a few weeks all the way to a very old age. Today I'm only going to talk about the adult side of the procedure. But if we start with what is cataract, cataract is basically an opacity in the normal lens inside the eye. So instead of the lens being crystal clear, it becomes slightly opaque or slightly grayish. Symptoms of cataract vary between individuals depending on the type of cataract. It can start as simply difficulty in focusing, reduced contrast, which is colors become less bright, things are more on the grayer side, and also glare with headlights in front of you. These are usually the starting symptoms, but as things go forward, vision actually deteriorates. Treating cataract surgery, in my point of view, is very, very individualized. So this is the approach in my clinic where we tailor things to your individual needs. Not everyone uses their eyes in the same way. The spectrum can be from a heavy goods vehicle driver all the way to someone that has limited mobility and doesn't go out of home. Both will have cataract, both will have the same cataract surgery, and both will have the same outcome from surgery, but their visual needs are completely different. And this is what we address in clinic. Eventually, all cataracts will need surgery at some point, but the timing of surgery is extremely individualized based on visual function. But not just that, it's also the decision of the type of lens that will be used in cataract surgery with all the pros and cons, because not at the end of the day, it is a replacement of the natural lens inside the eye. So nothing is 100%, but I think it is reasonable that people need to know what to expect, what can be done, and what are the downsides, or what is the it's kind of like what to expect from surgery that you'll gain, but there's a few things that you don't gain or become a bit tricky. Things, for example, if you go for one of the premium lenses for near and distance vision, then there's going to be a hit on contrast and glare at night. And it varies, and I think that is something that needs to be clearly discussed and tailored to each patient. From a cataract surgery point of view itself, at the Nuffield we offer local anesthetic that is done with drops, and also offer sedation and general anesthetic, which can be done very quickly within a few weeks. The procedure itself doesn't take long, takes a few minutes, I'd say less than 15 minutes in 95% of the time. We exchange the lens, so the lens that has the opacity goes by emulsifying it in place and washing it out, and a new foldable lens is put in its place. That lens power is based on the power of the eye, and it takes into account the power of the eye itself and the power of the cornea. And the power needed for your lens, for your glasses. So all of those are put in one, so you can get away with minimal or no need for glasses at all going forward for distance. Near is a different thing that will need to be discussed in details in clinic. Local anesthetic patients are very, very apprehensive around their eyes and they don't feel comfortable. It is a local anesthetic at the end of the day, so you will feel something. But it is best described by my patients as discomfort rather than pain. You will feel movement, pressure, bright light, water dribbling around the side, and all of that can be uncomfy, but there shouldn't be any pain. What I think I do well is good communication before and during surgery. So even when you're under local anesthetic, you would be fully aware and well communicated of when to expect a bit of pressure, when to expect a feeling of movement, and that usually eases things a lot and makes the procedure very, very quick. If you're interested in cataract surgery, whether it be it under a local or a general anesthetic, please contact me via my Doctify link or through my secretary, and we will be able to discuss this in a way that is very individualized to your visual needs. Thank you.